Welcome back to a brand new episode of Global Med Talks. Today's episode is going to be a really interesting one, especially if you're curious about surgery. I'm joined by my surgery doctor, Dr. Giorgi Kosmani, who's going to be sharing his experiences as a surgeon, give us some valuable advice for us medical students, and give us some interesting insights into the reality of working in surgery. I'm also joined by my fellow friends and medical students, Haaris and Nerisse. And a big shout out to Nerisse. She's also got a TikTok page, so I'll put that somewhere on the screen here. So definitely go check that out. So in this episode, I've got a lot of things planned. We're going to be talking about the rewards and pressures of surgery, some advice for us medical students, and what it takes to become a good doctor and a surgeon, and some other conversations that I think you guys are really going to enjoy. So sit back, relax, and I hope you enjoy the episode. First of all, I'm sure the doctor is curious as well. How did the exam go?
Yeah, exam went well. I should have focused more on the PowerPoints, but yeah, it was good. It was good.
Yeah.
Yeah, I'm happy I recognised what the OSCE was.
Okay.
Yeah.
Like, I feel like if you study the PowerPoints and if you studied well for the orals, you would have done well regardless. But it just threw me off because a lot of it was case studies. And so I was expecting a lot more straightforward questions, but that's why I found it a bit.
Yeah.
That's what I was saying.
Oh, that's what you
Study
wanted.
the PowerPoints well, and then you will have.
But generally, do you think you did well, or do you think you did bad?
We got it back, so yeah.
We did well. And that's honestly thanks to the doctor as well. Me personally, I think I did a lot better than my previous semester. Because last semester, I'm not gonna lie, I think I fluked the exam. But this semester, I actually knew what was going on. Like each question was like, okay, yeah, I think I know what to think about. I remember the lecture PowerPoint. I remember the doctor yelling at us and like coming up and drawing on the whiteboard and like drawing stuff like, the Roux-en-Y gastric bypass. I memorized the whole entire thing. So that was very useful. So, doctor, I wanted to ask you, so why become a surgeon?
One of the most common questions students ask me sometimes, Well, first, probably because I have grown up in doctor's family. My father is a surgeon too, and from very, very childhood. Mm-hmm. I was always be able to see there's lab coat which was taking to work, bringing back home, and then some very pleased patients who are visiting to give a big thank for the saving lives and so on. So I think I had no choice,
Okay.
And besides, why directly surgery? Because I think that any profession in medicine, commonly any profession in the world is good. There is no bad profession, but surgery gives a little bit more kind of ability to do intervention to another human's body, repair their something, and save the life. So it's quite exciting also. Yeah, and that's why.
I mean, especially because I had some experience in the UK when I was like doing some rotations. And some of the surgeons there were saying to me, it's like almost instant gratification. Like you see the patient that's struggling before, and then you do the surgery, and then a day later, they're totally fine. Like this feels so much more difference, and then it feels like good. Don't you agree? Like but whereas like other specialities, you need to wait a few months or a few weeks for them to feel better. But with surgery, it's a lot faster.
But the aim commonly is the same, to make patient feel better. You do it with surgical intervention, or you do it with an intervention of your mind without surgery. Mm-hmm. The main is what is your outcome. Outcome should be the health of the patient. That's it.
Yeah, true. So what's like been the most intense situation that you faced?
There is no surgery without intense situations. Commonly, mostly, if you mean which intense situation during the surgery, any surgeon will tell you most of all it was a bleeding. Bleeding, arterial bleeding, which was not so easy to control, Mm-hmm. This will be particularly the part of the surgeon. Any surgeon once at least in his life will experience this. Yeah. Second intense situation, which commonly happens during surgery, sometimes might be some strong adhesions, and dissection of which and visualization of the organ you are planning to operate on may be quite a tough thing and very difficult thing to do.
So what made you specifically choose general surgery?
Why general surgery? Probably because from the last years of the school, sometime I was visiting, you know, the staff with my father's ward, you know, and from the first year of my medical university, I was seeing the surgeries, you know, and that was making me quite excited. I always wanted to have ability. How, like students now, yeah, when they are assisting, they want to touch, feel how it feels.
Yeah.
This is normal, this is natural. So, being the chosen one to have ability to do intervention in another human's body and repair it, this feeling is something very different. You know, you have to feel to understand what does it feel. That's it.
Yeah, I understand, but I'd always think when I visualize you as a medical student, I think you have quite an analytical mind, so you would be suited to an internal medicine specialty as well. But I'm guessing it's the intervention that makes it.
Intervention makes absolutely different feeling, and here also absolutely different responsibility. You know, because when you do intervention, you take a big responsibility on yourself, and everything how the process will follow depends only on you, on your skills, on your accuracy, and of course on your knowledge, not only of surgical steps, but also it requires a perfect knowledge of the anatomy, you know.
I think I remember in the first surgery, so surgery 1 that you taught us, you said when you get the surgery bug or the adrenaline of the surgery, that's when you get addicted to surgery. Could you talk a little bit about that? So what got you?
I can tell you that this is a truth. The adrenaline which this release during the surgery, which comes because of you are responsible for every movement, every step, every dissection, every cut, you know. That's the main feeling, absolutely. Yeah.
So you feel like you're in a state of flow at that point?
Yeah, that's it.
You reach flow state.
Yeah.
So, doctor, if you were to choose any other specialty in medicine or maybe surgery, what would you choose if you didn't choose general surgery?
I think that any specialty, its medicine is good and have its kind of benefits. There is not profession which is better and which is worse or which is best and one is not so good, you know, but this depends on your preferences. Surgery requires a bit more, let's say, your personal time which you're going to dedicate to the patient than to compare probably with some therapeutic professions in the medicine, you know, but for me, any doctor is doing the same job as we do. If I have to interfere with my hands and with my knowledge, other doctors may interfere only with the knowledge, you know, you don't need the manual action, but this doesn't mean that, main thing again, we turn to the condition that we all together have one aim to cure the patient bring health to him, you know.
Yeah. Doctor, you know, on social media, people say like, oh, surgeons have they have really big egos. So how true is that?
I can't tell you what other surgeons feel, but I will not be quite completely agree with you in this case, you know. Maybe again we turn to condition, the ego comes from the feeling that I entered another human's body, I entered into another organism, I did some job, I repaired, and then I see the outcome of my job, which is the thankful and healthy patient. Maybe, but I repeat, the same does same endocrinologist, same does same cardiologist, but he intervenes not manually, intervenes with his mind, finds out the problem and cures it without surgery, because you know, best done surgery is not done surgery.
Yeah, I think it's also because like you do something that's really hard and you put a lot of time and effort into it, so you have that confidence. Like, you know, you're like, oh yeah, I'm that guy.
Yeah.
The confidence comes with experience. And
oh yeah, true.
Yeah.
So when you were starting out in your specialty, did you get a lot of nerves?
I think every beginner and every young surgeon will be a bit nervous, you know, because It's absolutely different thing when you work with some experienced surgeon and you are kind of his assistant and you work with him. You always know that if something goes wrong, you have someone to rely on. You are just assisting, so he's the main responsible person. But it's absolutely different feeling when you become the operating surgeon and then you are responsible completely for any kind of outcome may follow your done surgery, you know. So this comes with time, this comes with experience. Your responsibility doesn't decreases. You are just becoming more convinced because you are learning with the experience to understand one main thing in surgery is when to do surgery and why to do surgery, and not to do surgery because I can do it technically. As soon you will understand these main principles and be able to distinguish when you need to do surgery and why you need to do surgery, you will become more convinced then with time, you know.
Yeah. I've got a question for you two guys. Could you see yourself becoming a surgeon?
Oh, he's staring at us now. I personally, yeah, I can. Because I love using my hands. I'm very I did like art GCSE, so I love dexterity and like using my hands to like paint and draw. So with surgery, it was sort of like using your knowledge as well as using your hands as well. So that's why I've been looking into it, but I'm not quite sure yet. How about you, Haaris?
You know, when I came to medical school, I was like, yeah, I want to do surgery. I want to do general surgery.
Every student says that I want to become a cardiothorac surgeon.
Yeah, I was like, yeah, this is the one for me. I'm ready. But no, coming to uni, like I'm not squeamish, but I just don't think surgery is for me. I think, you know, the intense amount of responsibility that you spoke about, I think that scares me a little bit because I'm thinking about doing oncology in the future, like therapeutic oncology. So if I make a mistake with the medication, the pharmacist can pick up on it. But if I make a mistake when I'm doing a surgery, there's nothing.
No, I don't. That's not the correct way of your thought, Haaris, because responsibility is absolutely equal. Surgeon, oncologist, radiologist, psychiatrist, responsibility is absolutely equal. Responsibility, you take about what? About treatment of the patient. I mean, your responsibility to organize and be convinced to give him correct medication. You know, because see, in case of oncology, you are not giving correct medication, and with time, the disease, which is oncology, which is the cancer you are dealing with, progresses silently, and then in a few period of time when patient visits you after finishing the course, instead of improvement, you might reach the condition when even nothing can help me anymore because you were mistaken giving him this course of medication. So responsibility in any profession in the medical field, guys, is absolutely the same, you know.
Yeah.
I think for me, I get nervous about like being a doctor and stuff, but only because I've got this problem. Yeah, it's like if you said, "Oh, Heather, you want to be a surgeon?" I imagine myself, "Oh, I have to do this surgery tomorrow. Like, what am I gonna do tomorrow?" Do you know what I mean?
Okay.
So I'm like, okay, wait, hold up a second. Like, I don't know what to do. Like, what's this? What's the process? What are the steps? So, but like, I was thinking about this last night as well. If you practice and if you go into surgical residency and if you train for like 5-6 years, I mean, how long is surgery like in Georgia? Like the training?
You mean the residence?
Yeah.
The residence is 4 years.
4 years, yeah. So, I mean, I reckon after 4 years of like proper hardcore surgical training, I think I could do it.
Yeah.
You should understand one thing. You technically, to learn steps of surgery, you can learn it in these 3-4 years, you know, because each surgery normally has some steps which you need to do, which are prescribed in an auto books and so on and so on. You know. Besides this, the technical part is not the most important. Yeah, you should have a very strong hand, and your hand should follow your knowledge. But more important, to understand the principles of indication. You choose to operate patient. So you should know what is the indication of surgery. Will your surgery bring benefit? Or if it will not be bringing benefit, then why commonly you do intervention? That's more important thing to understand, because technical aspects of how to cut and how to put a stitch, this you will learn with the period of time while having intensive course of surgery. 'Cause good surgeon knows how to operate. Yeah.
Great surgeon.
Better surgeon knows when to
When-
operate, and the best surgeon knows when not to operate. That's the thing.
Yeah.
You know, doctor, sorry, one sec. You know, when we were upstairs, remember you told me a story of how a guy, he used to do, like ages ago, he used to do surgery, but without any knowledge, and he used to do it like really fast. But then he learned the knowledge and then he took his time with it. Do you mind sharing that story for us? 'Cause I think
Yeah,
that's
this
quite
is an
important.
old story. It's kind of, a tale
Okay.
that one doctor has an assistant who had no medical education,
Okay.
but he was assisting the doctor technically, and he was doing appendectomy in 15, 20 minutes. But then with time, we also got theoretical knowledge and studied the parts of anatomy and so on. So after he was doing the surgery in 40 minutes, why? Because after getting theoretical knowledge, he absolutely differently saw the field of surgery, and he was taking care to avoid damage of additional neighboring structures.
Yeah.
That's the thing.
Yeah, I think the knowledge part is quite essential. You want to-
So I have a question. So, in terms of women in the surgical field, what is your view on maternity leave as well as starting a family? Because I know a lot of women that want to go into surgery, they try and avoid it because there's this preconception that basically once you start your surgical training, you're going to have to postpone a family life, you're going to have to postpone marriage, having kids, because it's so intense. What are your views on that?
I think a good question, the kind of question with absolutely different thoughts and visions, but I can't tell you the view of other people, especially who live in another country in Europe, so on and so on. But on my opinion, probably, after graduating, the first at least 6-7 years are the most intense, where you gradually reach the condition to become a surgeon, independent surgeon, and you have to pass some specific stuff and things. So it requires more attention, more time being in the hospital than at home, because if you are more in the hospital, you see more cases, and the period which grows you up as surgeon as more different cases you see, because every patient is very individual, And another thing is paying more time at home for your family, for children, if you have family, and so on. So, it may kind of be controversial, but I don't think that the kind of stuff that women, if they want to become, they can become great surgeon. I know some who are one of the greatest surgeons in the world, in Georgia and outside of the Georgia, So we say in Georgia, the main what you have here, what you feel and what you wish. If you wish, you can somehow manage,
Is it quite hard to balance like family life and social life alongside surgery and being a surgeon?
Well, probably it might kind of be dependent on occupation. Like, see, where is your occupation? If you work in a big hospital where you have emergency surgery and you are doing the night shift rounds and so on, so you might have need to get more and spend more time in the hospital. You know? Another thing, if you work in the hospital where you do only elective surgery and you don't do emergency surgery, then in this case, first period of day is occupied by the work, and then in majority of cases you might have, in comparison, a bit more free time.
Okay.
How about you, Doctor? How do you balance your family life, your hobbies alongside, because you're also a teacher, a lecturer, alongside being a surgeon. So how do you balance everything?
Well, for nowadays, the most time is taken by you guys, by students, to give them some education and explain as much as possible the main things of surgery and of medicine commonly. So,
Do you get enough sleep?
trying to.
I came into lecture one day and I was like, Doctor, I didn't get enough sleep. I got less than 8 hours. He looked at me, he was like, 6 hours is enough. I was like, no, it's not.
6
Honestly,
hours are not
throughout this
enough.
whole entire 3 weeks of having surgery with
Yeah.
you, I didn't even sleep like a full 8 hours because I had scientific reasoning before, at the same time as surgery. And then I had to go home. I went home at like 9 p.m. I ate when James came back,
Yeah.
and then I started studying at like 11 p.m. And I'd always finish at like 4 a.m., 5 a.m. And then I have to wake up, come surgery class, do the oral.
Yeah.
So it was quite intense, but you know, we got there in the end.
Initially, you will have a lot of sleepless nights after
Yeah.
graduating if you're going to follow surgery, because I advocate every beginner to always start in some big clinic with emergency surgery, you know, because here you will see a lot of different cases, how to manage. And here during shift, you might have a lot of sleepless nights because never know when patient will feel ill or when some accident will happen and you will receive the patient, you know.
Yeah.
So this is the important part that any young surgeon should be quite familiar to, is the emergency surgery undoubtedly, you know.
Yeah.
And then maybe with time of 10, 15 years experience, if you want and wish and kind of tired being in emergency, you can choose doing just only the
Yeah, I think that's the
elective
thing with med
surgeries.
school as well. Like, it prepares you for the real life. A lot of people, like in our uni and stuff, they complain, "Oh, this doctor's too hard. The doctor's this. I want to sleep. You know, I want to have fun in med school." But I feel like it's kind of important because it does prepare you for the real world. So you need to be resilient. You need to be resilient. Like, you are gonna get less sleep, like you said, and it's gonna be hard. So you might as well start training yourself now. What do you think, Haaris?
Yeah, I fully agree with that. I think I've become a lot more of a resilient person after medical school. After the first 3 years, especially.
Oh yeah, true.
Like coming into uni, 2-3 orals a day after day.
Honestly.
But yeah, but no, I'm enjoying doing the rotations a lot more.
Yeah.
I think you're actually learning on some of the pieces that theoretically you knew, but they're more clicking into place now.
Yeah, true.
Yeah. Especially when you explain some of the implications of the anatomy when we're talking about surgery, especially with the triangle when we're doing liver surgery, is it?
Which triangle? There are a lot of triangles in the back. I think you mean triangle of Calais,
Yeah, triangle of color.
where we find which artery?
Hepatic artery.
Cystic.
Cystic artery.
Yeah.
There is no surgery without good knowledge of the anatomy, you know? How? You cannot do surgery on the organ, which position, placement, and attached structures you don't know.
So, doctor, you said a good surgeon can do their surgery well, but a great surgeon knows when to turn down a surgery. So you do a lot of bariatric surgeries, right?
Kind of.
So,
Not only, but kind of.
So has there ever been a time where you've had to turn down a patient for a bariatric surgery because, let's say, they were overweight? Has that ever happened to you?
Yeah, why not? You can, if there are some kind of comorbidities which increases risk of the outcome during, because obese patient might have a lot of comorbid diseases, you know. According to this, sometimes the disease might be contraindication to do surgery, maybe now, at this moment, until you will not do some kind of correction of this comorbidity, because this is a chronic condition. There is no emergency situation, or might be kind of specific conditions like if he has alcohol or drug abuse, or there is history of cancer and so on, then this is the rule when the bariatric surgery is not indicated, you know. But this doesn't mean we cannot take care of the patient's weight loss therapeutically.
So, with these patients, with the advent of these new GLP-1s, What do you think the role of bariatric surgery is going to be going forward?
I don't think that might be kind of controversial to each other, you know. But my vision is that if it's possible to lose weight without surgery, with the same long-term outcomes, which is more interesting in this field commonly, and with the same good outcomes of normalization and cure of all the pathologies which are associated with the obesity, then why not?
Yeah. I think that pretty much covers it.
Oh,
Well, did you have another question or?
Doctor, has there ever been a case throughout your whole career that has stayed with you?
What do you mean?
Where, like a patient has come with like a really rare disease, or maybe there was a patient that you thought was going to recover really well from surgery but ended up not recovering as well, and that it stayed with you?
About rare case, yeah, I was lucky to have one really rare case because it was explained in the literature worldwide up to 14, 15 cases. That was the cyst of the canal of neck in adult female. Well, normally it's a congenital condition, you know, but in adult females it's quite rare. And then when I started searching, I found out that before me, 13 cases were only published, from which 10 was the right side and 3 was the left side. So mine was the 14th case. And the fourth, because it was left-sided cyst of the channel of neck in 42 years old female. So we did surgery, we did publication. By the way, the students from our university also talked about this case in the student conference. I think it was 3 or 4 years ago, and then took the first place. And also I have did the speech of this case in surgical conference also here. So
In Georgia?
yeah. You know, we should understand one thing, that every person, you might have dealing 10 years with same disease, you know, but every patient is specifically individual, you know, with their anatomy, their complexion, their comorbidities, their thoughts, their fears, and so on and so on.
Last but not least, Doctor, how are we as students?
Could you see us becoming surgeons?
Why not?
Fair. That would be.
Why not? The most important is, if I always advise to any student, do what you like to do, you know? If you will do what you like to do, what you are completely into, what completely gives you a big potential and interest, you will do it well.
Yeah, I think that's one of the big things. A lot of people have said that to me as well. Like, as long as you like it, you know, you'll be all right.
You should do what you like to
Yeah,
do.
100%.
And not because it's like giving you more prestige or maybe more payable, you know, or gives you more some respect. No, because in this case, you'll reach some level and you'll stop because you lose your interest.
True. Well, anyway, thank you so much, Doctor, for sharing your.
Thank you for inviting me.
No problem, and thank you for my friends as well for coming on. Even though I did kind of force you to come, but you know, I'm very grateful that you came. Thank you very much, guys, for listening. And if you enjoyed the episode, like the video and comment down below. And yeah, I'll see you in the next episode.
Bye.